Lionel Messi was subbed off with a non-contact right lower leg injury late in tonight's Copa America final, and in this video we're going to take a look at the play it occurred and how serious this could be. Welcome back everybody, I'm Dr. Brian Suter, and the goal in this channel is to help teach you about the medical side of the sports world. And in this video we're going to be taking a closer look here at Messi's right lower leg, I suspect right ankle. Now we get a nice clue from the broadcast footage here showing the location of the ice applied to Messi's right lower extremity, so right away we can tell that we're going to be dealing with the inside, or specifically the medial portion of Messi's right ankle. In anatomic terms, medial is the inner part, so this is going to be the medial, lateral is the outer side. So the ice being applied there on the medial side of the ankle, you know, it's not up in the hamstring, it's not down in the calf or posterior on the backside near the Achilles, on that medial side. So we'll focus on the structures on the medial ankle and then see how that correlates with the injury mechanism. It's this step that I think the injury occurred on. And in this position, we can see a nice neutral alignment of Messi's lower leg and that right ankle. But then as he is landing and is pushing off to try and change directions, we now see a sudden amount of ankle eversion. So if we look again down the direction of the tibia, we're not directly square on, so it's a little bit more extreme looking than this angle, but still with that foot pointed in this direction compared to the location of the rest of his tibia, that's going to do a couple of things. It's going to put eversion stress or tension on those inner structures of the ankle, and then also in the right setting can put some external rotation stress on the location of a high ankle sprain. Now, I didn't see any clear pop or snap in the back of the leg, suggesting like an Achilles rupture, so I don't think that's necessarily something on the table. Another just concerning thing right away for severity is we saw when the medical staff got out there, there was no exam that was done. They basically asked him what happened. He said something and they subbed him out. And so presumably he said something like, I felt a pop, or it popped, or it tore, something like that, that told the medical staff, hey, we're done. He's coming off. We don't even need to examine him. Next, we're going to take a look at our anatomy model and what exactly the structures are that could have been injured on the inside of his ankle. But first, I want to give a quick shout out to the sponsor of this video. Today's video is sponsored by Bombas. The best workout starts with the best gear, and Bombas performance socks are the workout essential that you can't go without. My daily go-to are their ankle running socks. These things are designed with comfort at the forefront. There's no annoying toe seams in Bombas socks. They have this nice built-in arch support, but Bombas also has a great athletic lineup for any of your athletic needs. If you love skiing or snowboarding, they've got these really nice ski and snowboard socks with a nice tall area to them to help keep your leg nice and protected and warm. If you're looking for something more lightweight, they have a really nice thin lighter weight sock that I think is great for those long runs. And I also love this really nice, extremely soft and temperature regulating merino wool blend. Right now, if you head to bombas.com/BrianS and use code BrianS at checkout, or click the QR code over here, you can get 20% off your first Bombas purchase. I also love that Bombas' mission is dedicated to helping others, with one purchased equaling one donated. So with every purchase, Bombas donates an item to someone experiencing homelessness. So up your workout game by getting into a pair of Bombas socks today. Again, scan the QR code on the screen or head to bombas.com/BrianS to get 20% off your first Bombas purchase. Thank you again to Bombas for sponsoring the video, and let's get back to our learning. The final thing we saw from the broadcast was the severe amount of swelling around Messi's right ankle once he removed that ice. And it's nice to see him remove the ice. Of course, you don't want to keep ice on for any more than maybe 15, 20 minutes, especially direct contact to the skin. So nice sports medicine tip there. They took the ice off after an appropriate amount of time so that you don't get any cold burns on the skin. But here we can see there's swelling not just on one location. There's no swelling really up in the leg, just a lot of soft tissue swelling around both the lateral, anterior, just diffusely around the ankle, suggesting again, probably a pretty serious ankle injury for there to be this much swelling right away. So now if we look at our biodigital anatomy tool here, I've basically shown everything initially, but we're gonna focus on that medial side. So looking straight on at the ankle, this is going to be the medial side, this is going to be the lateral. If we zoom in, the main structures in terms of tendons are going to be the structures of the tarsal tunnel. Tarsus is ankle, and so the tarsal tunnel is this area through the inner part of the ankle where a key number of tendons, blood vessels, and nerves travel. The first one is going to be the posterior tibialis tendon. It comes down and inserts on predominantly the navicular bone, and it's really important for maintaining kind of the arch integrity of our foot. As we then continue down around that tarsal tunnel, we're going to have the flexor digitorum longus. Flexor, meaning it curls, digits, the toes, and so it curls the toes downward. The third tendon is going to be the flexor hallucis longus, hallucis meaning big toe, and so this one just flexes or curls the big toe. So 3 tendons going through the tarsal tunnel, and then we also have the tibial nerve tibial artery and vein that run through this tarsal tunnel. So one thing that could have happened here is Messi could have had an injury to one of those tendons because you're going to get stretched in that eversion position. You're going to pull in those tendons. You could have a tendon injury in that tarsal tunnel. Deep to those tarsal tunnel tendons is going to be the key ligament, the deltoid ligament. The deltoid ligament complex is a number of ligaments that run from the distal part of the tibia that bump on the inside of your ankle down to the calcaneus, to the talus, and the navicular bone even. And all of those are going to be important with stabilizing and preventing that eversion stress. So if we go back and look at that picture of Messi's ankle, you can imagine how in this position there's going to be a lot of tension or stress on that inside part, those inner structures of the ankle. Going back to our anatomy tool, then the other thing just to keep in mind is going to be that high ankle sprain ligament. That's called the AITFL. And if we get rid of some of these other tendons here that aren't as important or necessary for the sake of this discussion, then we can see that guy a little bit better. That AITFL, the high ankle sprain ligament sitting right here between the tibia, the shin bone, and the fibula. When you get your foot in that everted, externally rotated position, that can certainly cause injury to this ligament. And so this could very well be tendon, this could very well be ligament. But again, I don't think it's a dreaded Achilles. So overall, this does look to be at least a moderately concerning injury for Messi. The fact that it was non-contact, right away he knew there was high level of concern, and we saw this much swelling develop in his ankle. I expect at a minimum he's got a significant enough sprain and very well could have injured one of those tendons. If any of you watch basketball and saw what happened with Kristaps Porzingis, where he had that dislocation of the posterior tibialis tendon, something like that could have happened here too, where that little band that keeps those tendons in place could have torn, allowing one of those tendons in that tarsal tunnel to dislocate. So I imagine we're going to see an MRI for Messi, and then to be determined with how much time he could miss for Inter Miami in the upcoming remainder of the MLS season. That's it for the video, but everybody let me know any questions or comments down below, and until next time, we'll see you later. Bye.